Hi, Pharmacist Brad White from the Medicine Center Pharmacy, and I want to give you a more detailed outline for both patients and providers on low-dose naltrexone's use for pain management. There's a lot of different things to consider with respect to low-dose naltrexone and its applications, so I hope you enjoy this, and if you have questions, please put them in the comments below so that we can engage. This video is for patients struggling with chronic pain or healthcare providers looking for alternative treatments to expand their treatment options. So what I'm going to cover in this video is how LDN works for pain, which conditions it helps with, and the benefits, risks, and real-world usage. By the end, you'll know if LDN is the missing piece of pain management therapy for you. What is low-dose naltrexone? Regular naltrexone tablets come in 50 milligrams. Low-dose naltrexone is any dose between 1 and maybe 15 milligrams, depending on what the doctor might order. The higher doses are used for opioid addiction and alcohol addiction and things of that nature. The lower doses can be used for what we're going to talk about in this video. So the full dose blocks opioid effects used for addiction. Lower doses have immunomodulatory effects instead of blocking opioid receptors. Key effects at low doses: you can get pain relief, anti-inflammatory action, and immune system modulation. LDN is not a painkiller in the traditional sense, it's a pain modulator. So how does LDN work for pain? Think of LDN as hacking your body's natural pain control system. It boosts endorphins, which is the feel-good chemicals. It temporarily blocks opioid receptors, which makes the body increase natural opioids like endorphins and enkephalins. What's the result? You get better pain tolerance and less discomfort. It reduces inflammation at the nerve level because it blocks toll-like receptors number 4, in addition to microglial cells. Why is that important? Microglia are the fire alarms for pain and inflammation. When overactive, they make pain worse. LDN calms them down, reducing chronic inflammation. LDN can also lower substance P, which is a pain signal messenger. Substance P is a neurotransmitter that tells your brain, I'm in pain. So LDN reduces substance P, leading to less pain signaling. So who could benefit from LDN? LDN is not just for one type of pain, so let's try to break it down. Patients with arthritis, rheumatoid, or osteoarthritis, it can lower inflammation, it can reduce need for non-steroidal anti-inflammatories or opioids, it may help modulate the immune system in autoimmune arthritis. Fibromyalgia, it helps with widespread pain, fatigue, and sleep issues. Clinical studies now show improvement in symptoms with few side effects. Complex regional pain syndrome is a very complex situation where pain proportions are just out of control to the injury. LDN may calm nerve hypersensitivity and inflammation. There's so much emerging research. There are literally hundreds and hundreds of articles on LDN and how they may be associated with neuropathic pain, multiple sclerosis, inflammatory conditions like Crohn's disease, but you got to know how to dose it. And what's important about LDN is typically you need to do a titration dose schedule. You need to start low and go slow. You need to start low, like at maybe 0.5 milligram, and slowly increase over a couple of weeks. And a compounding pharmacy like ours can help a doctor navigate that dosing schedule and help find the patient's best source for their results. So what we can do is we can compound LDN into a variety of different products. It can be a capsule, it can be a troche, it can be a liquid, and all of these can be dosed to the point where you can get what's right for the patient at the right condition for the right response. Many patients want to know how long before you start to see results. Some notice improvement in just a few weeks. Depending on their clinical situation, it could take a little longer. It could be several months or even a year. Is LDN right for you? LDN is great, but it's not for everyone. And why is that? Well, first off, on the positive side, it's very affordable. It's a fraction of the cost of the biologics or the long-term opioid therapies that are on the market today. It is safe and very well tolerated. It's been on the market for decades with very little side effect profile when dosed in small doses. It is non-addictive and non-sedating, unlike opioids or muscle relaxers. And it addresses both pain and inflammation. So the cons, important considerations. You could argue that not many doctors are familiar with LDN. They don't learn about it in school, despite the fact that there are hundreds and hundreds of well-researched journal articles out there with credible references. So sometimes the doctor needs to make some education investments, and we can help with that at the pharmacy. There's also very limited large-scale studies. No drug company can patent this drug because it's been on the market for decades. So as a result, you don't see these giant trials out there in flashy TV ads because drug companies can't patent it. So as a result, you don't have more education available to doctors unless they go looking for it or a patient brings it to them. So for final thoughts, should you try LDN? LDN isn't a magic pill, but it is a very powerful tool in pain management. If you're a patient and you're suffering from chronic pain and you've tried a number of different medications, talk to your prescriber about LDN as an alternative. We can be a resource here at the Medicine Center Pharmacy to try to help you communicate and educate your provider if they're unaware. And it's okay. There's so many things in medicine to learn. It's not unlikely that they may not have heard about LDN yet. So there's new research all the time, and we can help be a conduit to help you and your provider learn more about LDN and how it can be used in pain. If you're a provider considering adding LDN to your toolkit for patients struggling with chronic pain, LDN is changing lives, and it could change yours. Drop a comment below. Have you used LDN before with your patients, or are you a patient that's used LDN? What was your experience, or what's it like now? We'd really appreciate it if you would like our video and subscribe to it so that we can help spread the word about LDN. It's an incredibly important medication that's available in the marketplace today, and it might be something that you help today share with other people that it could end up changing their lives. So thank you very much for listening. Please reach out to us at the Medicine Center Pharmacy for a custom consultation if you'd like. And thank you for watching our video today.